Hello, my name is Robert Dempsey, one of the co-founders of the Holland Foundation, and today I'm joined with the man himself, Dr. Edward Holland. And what we would like to do is take a moment to reflect over the past couple of years, what we've been able to accomplish at the Holland Foundation. What I'd like to do is kind of talk about where we were back before COVID, when we identified a significant unmet need for patients traveling across the country for this innovative treatment taking place in Cincinnati. I had an opportunity to work with Dr. Holland back, and I looked across the patient population and identified these patients are coming in from across the country. What can we do to address this significant burden? And the two things that we identified was, number one, physician education, and number two, opening up centers of excellence. What's critical though, for us to achieve these goals is for financial support. So we will continue our fundraising efforts to go out there, solicit funds so we can provide education, we can provide funds for transplant coordinators, and ensure these centers have the resources they need. Dr. Holland?
Well, I certainly give Bob Dempsey a lot of credit. You know, we spent years and years addressing what I think is one of the biggest unmet needs in all of ophthalmology, and that's patients with severe ocular surface disease with limbal stem cell failure. You know, these patients are blind, they have a terrible quality of life, their eyes hurt. And, you know, I was focused on creating procedures and management to really, you know, reconstruct these eyes and get these patients a better life. Yeah. Bob realized that, you know, I was missing the big picture. It's like, how do we get more patients treated? And, you know, we have patients coming from all 50 states, coming from South America, Europe, and it's just not sustainable for a center to even start to really make a dent in the huge patient need. And so Bob and a couple other really, you know, innovative people saw that, why don't we bring the care to the patient? So why don't we recreate what we call the Cincinnati protocol, which has been proven, and we've published our results in peer-reviewed journals. The procedures work, the procedures are, and the management of these patients safe. You have to build a center of excellence with the quarterback of the team has to be the cornea surgeon, but you need glaucoma surgeons, retina surgeons, oculoplastic surgeons. You need to collaborate with renal transplantation because the biggest complication we have is rejection. And the subspecialty that learned about prevention of rejection was really the renal team in kidney transplantation. Then finally, to really tie the program together, the coordinator of the program is the transplant coordinator nurse. Unfortunately, ophthalmology, we really don't have a way to directly fund those through the way we can bill now. And so our foundation is raising money to help hire transplant coordinators and create these teams. And again, I give Bob a lot of credit for having this vision of, let's take what we're doing in Cincinnati and let's create centers all over the country, and let's teach other doctors to bring this care locally.
And lastly, I think what also excites us is the collaboration between the ophthalmic industry, individuals who are dedicated to working with Dr. Holland and ensure patients have that access. So we have a great board of individuals that work with us. We bring different skill sets, whether it's a finance, fundraising, medical, such as our new chairman, Dr. Steve Lane. So it's a great collaboration of individuals who are focused on addressing this significant unmet need. Because for patients to have an option of a dog or a stick is not how we want to live today. And the great work that Dr. Holland is giving the gift of sight to these patients is truly remarkable. And that's what motivates us to reach out and work with these physicians. Thank you very much. And if you're interested in providing financial resources, we have a beautiful website and you can give a financial donation there. Thank you very much.